Hi, Jen.
Hi, Bethany.
How are you today?
I'm great. I'm so excited. We have a very special guest today. We have with us Dr. Caroline Rich. She is a doctor of occupational therapy, and she specializes in women's health. I came across her and her work when I was searching through, looking for any and all resources, research articles on recovery after C-section, and she wrote an amazing article. I was cheering the whole way through.
Yes.
It is called Occupational Therapist's Role in Maternal Health in the Home Environment After Cesarean Section.
We are so excited that you wrote this. It's such an important piece.
About, all of your ideas, all of your plans. Caroline Rich, welcome to the show. How are you doing?
I'm good. How are you all doing?
Great. Thank you so much for joining us. First, just tell us a little bit about yourself, your journey, how you came to writing this piece of work. Just start anywhere you'd like to start.
Sure. So I went to occupational therapy school and graduated right before the pandemic hit. And so my first week of work was a week before everything shut down in March of 2020. And so I saw firsthand kind of our healthcare system is a very reactionary system and not a lot of focus on prevention. I had the opportunity, when the world kind of shut down, to work on my post-professional doctorate. I had just finished the master's, but was able to go pretty immediately into the doctorate. At the time I entered, I had a focus. I was working in patient rehab. I have been a horseback rider my whole life, and so I was really interested in equine assisted therapy. So that was kind of the trajectory that I thought I was going to be on. And then through the process of being in my doctorate, I had my daughter. And becoming a mom just turned my whole world upside down.
Oh, yes.
In the best way, but also in the hardest ways. Having a pandemic baby, I was younger than a lot of my friends who were having their first, they weren't in a stage of having babies. So I didn't really have community. I found it was really hard to find resources within, especially during pandemic times, but even post-pandemic times. And I suffered from postpartum anxiety and depression, and walking through that experience, I was like, oh my gosh, there's such limited resources for women. And so through that experience, my daughter had some health issues. I took a year off from the doctorate, which is really hard to do because before becoming a mom, I was like, I can push through things. I can just dig my heels in and get it done. And it was the first time in my life where I was like, I can't, and I need to focus on my own mental health and my daughter. And so anyways, when I came back to the program was when it was time to start developing what I was going to do for my capstone. My eyes had been really opened to the gaps in care. And at the time I was working in home health, mostly with the geriatric population. And I was treating people who had had knee replacements and hip replacements and abdominal surgery, just really a variety of neurological events. And so when I was trying to see how my professional work could merge with this new passion of women's health, I started digging into C-sections because I didn't personally have one, but I was the product of an emergency C-section, and saw my mom, saw my mom suffer for years and still having complications from not having proper recovery from her C-section. And then she ended up having pelvic surgery, lots of cuts in that same area. And so I started digging into the research, similar to you, Jen, of seeing what was out there and realized there was nothing.
Yeah.
There's absolutely nothing. There's an initiative that you guys have talked about in your podcast starting in 2018 of enhanced recovery after cesarean, which is amazing in the hospital environment. But say you're only in the hospital for 2 to 4 days and then you get released home. And it's like, okay, well, it's amazing. There's been such advancements, but there's nothing transitioning into the home environment, that's the rest of your life.
Exactly.
And so in the research I've done, it seems like there's more of a push to get women in closer to the 2 to 4 week mark after they've been discharged home. But that's fairly new, it seems like. And we did a needs assessment, just a Google Forms, that I posted on social media. This was for women who had had C-sections at any point in time. And most of them said they were not seen until that 6 week mark.
We weren't seen until 6 weeks, right? Yeah.
Which
crazy.
is just
I know.
insane.
I know.
Yeah. I'm like, if you have any other surgery, you're seen so much sooner, or you're given home health where they're assessing the wound for infections. They're giving you education for blood clot prevention, all the things that can happen after surgery. you're not seen for 6 weeks, it was mind blowing. So anyways, that's a long story short of how I landed on this topic, because I felt so passionate about improving women's health in some way. And then I felt like my own professional experience could be combined with trying to improve women's healthcare. And it really helped that my mentor and professor, who is the co-author of the study, Dr. Alicia Scoothan, her husband, Dr. Scoothan, was an OBGYN resident at the time of her being my mentor. And so that was a really cool collaboration as well, of being able to say, okay, well, why is there not, a specific protocol? And he didn't have answers.
I was going to say, did you get any answers?
Yeah.
Why are you waiting so long to see these women?
I know. But one thing he did say was, especially like in an emergency situation, there's, I guess, different methods depending on how big the baby is, the mom's anatomy, different things like that. But even so, it seems like there's a better way.
Right. Well, regardless of, different needs, in the recovery period, like that makes sense. But everyone needs something, and we need to identify the people that maybe even need more than others.
I have to say something the second I knew you were a mom was when I read your abstract, and that you used the word, we argue, for occupational therapy and the important role that it plays to a mom. And the word argue, I'm like, why is it that we have to argue this? Why is it that we have to? I mean, that for me was just like this glaring word of like, that's, I feel like what Jen and I spent a lot of time doing, that I guess I never put that word argue on it. It's like, we just want better. We know there can be better, and we have resources that if we utilize them in a better way, it would be a better outcome for both patients and for practitioners as well. They can serve on both sides.
Yeah, that's what was so eye-opening for me. I hadn't really thought, we started to think about the role of a physical therapist. Mm-hmm. Mm-hmm. And, I think that's becoming a little bit more mainstream, where people, no matter how you give birth, are thinking about the need for physical therapy. But when I started reading about what an occupational therapist can do, it's so mind-blowing. I want you to help me understand a little bit first about the idea of home health. Like, if you could explain that concept a little bit more, because what we're arguing for, right, is that postpartum women, C-section moms, deserve home health. So can you just tell us a little bit more about what that term means, what it usually includes, I guess, in any population, whatever you're familiar with, so we can get a sense?
Sure. So one step back, I'll explain what occupational therapy is, because I think most people have no idea.
Yes.
I have been told, like, oh, do you help people get jobs? Because of the word occupation,
right.
You think of getting a job. So anything that occupies your time, that brings purpose and meaning to your life, think about, as soon as you get up in the morning, you have to get yourself out of bed. You have to get dressed. This is just your own personal self-care, brush your teeth and go through the motions of your day, go to the bathroom, take a shower. Occupational therapy focuses on anything that puts barriers on your, activities of daily living. That's just the basics. And then there's higher levels of instrumental activities of daily living, when you have to go to a job, you have to clean your house, you have to take your dogs out, you have to take care of your kids, it builds on itself. And so from at the very basic level, when you're talking about home health, say, I'll give the example of, say, somebody who's had a hip replacement. They can't bend past 90 degrees, so they can't reach down to the ground. That's a precaution after hip replacement surgery. And so how are you going to put your shoes on? How are you going to go to the bathroom? How are you going to do all those activities of daily living that you've always taken for granted because you've always been able to touch the floor, and so occupational therapy focuses on adapted equipment or setting up your environment in a way that's conducive. You're not supposed to really do stairs after that. I give that example because there's a lot of overlap in the precautions that I've seen for C-section recovery. Again, not that they are extremely defined. Every OB has like slightly different variations on what they want and what time period they want them done in, but there is a lot of overlap. And I haven't seen this much in the literature, but when you think about it, and you guys can confirm because you had them, but I'm assuming bending down past 90 degrees, you're going to put a lot of tension on that abdominal wound.
And let's start with getting out of bed.
I was just going to start with that too.
Step one.
Let's talk about the basics. Get out of bed and taking a shower. I mean,
yes.
How I think what you just do is you just get into survival mode. I mean, I feel like that's
Yeah.
what I did. It's like, yeah, I wish there was a handle right there, but like I don't have a handle. So let me like pull on the side of my bed in an awkward, weird way to try to get out of bed in the least painful way possible. But yeah,
Yeah.
I didn't even think about utilizing a resource of like OT and how that could have been so
I mean,
beneficial.
imagine having someone come set up your house, look at exactly what your bathroom looks like. If you have, I mean, that's
Yeah.
just sounds like a made up luxury. Like, I
Right.
can't believe
Well,
that.
I think that's the key word. It's like that people would see that as a luxury versus this is a necessity. You have also had a surgery, just as a patient who had a hip surgery and has
Mhm.
these barriers to simple everyday tasks that you don't even think about getting out of bed and getting into the shower if you've never had a surgery before. It just feels like, oh,
Well,
okay,
plus you
whatever.
have this brand new occupation of taking care of a newborn.
Yeah.
Where's the newborn sleeping? You
Mhm.
know, in what, I don't know if you think about stuff like that, but yeah, like what type of crib they're in, if it's
Mhm.
like a low down or next to the bed or where it is, where you should keep all of these things in relation to where you're going to be sleeping or where you're going to be spending the most time, where you're going to be feeding. I mean,
Yeah.
as we all
It's
know,
huge.
any of us who's had a newborn, the list is endless
It
of,
is.
Yes.
you know, of everything we need to do to take care of them. So
Mhm.
it's crazy.
Step one would just be taking care of yourself. And I think that is where the importance, a lot of people who know that they're going into surgery in the home health environment, they will get services or at least outpatient, if not in home, to prepare their environment and their mind and their body, everything starting pre-surgery, especially if it's a planned C-section, because get ahead of the game, like
Right.
let's talk about, we don't know exactly what your limitations are going to be, but we know generally based on this surgery what it is, what the recovery looks like. So how can we do an environmental assessment of your home and get it set up to the best of your ability and have resources for a lactation consultant already in place, have resources for a pelvic floor physical therapist in place, like all the things that you may need or may not need, a mental health counselor, if you start experiencing postpartum, like all the things in place. So you have resources before you're home and you're floundering and you're like, what the heck has happened to my
Yeah.
life?
Right.
Especially if you're a first time mom and you've never experienced taking care of a newborn before. Like you're immediately, I know again, I didn't have a C-section, but my needs were out the window when I had her because she had health things that needed to be taken care of. And I never had any provider asking like, well, how are you doing in all of this,
Right.
Yeah.
And so I think obviously it would be difficult to do that for the population that are having emergency C-sections. But I think that is something that would be so important and not a luxury, but standardized care
Yeah.
of having the prep before the surgery and then followed up with those weekly, biweekly, whatever it is, visits until you're cleared. And then you can go on to outpatient pelvic floor therapy, any resources you need. But I just think being in the home, like that is the vulnerable place where so many women just silently suffer because they think, well, this must be normal or this is just what it is like to have a baby. And especially if you're not in community, to talk to other moms of,
Yeah.
that was me. I was like, oh my gosh, like even my milk coming in, I'm like, what is happening to me?
Yeah.
So many things it would just be so helpful to have somebody like walking with you along the way.
Totally. I have to read one of the sentences that you wrote because I just loved it so much. That you said this column gives a voice to the often invisible struggles of mothers suffering in silence in the acute postpartum stage of C-section recovery in the hope of bringing positive change to maternal health outcomes through the provisions of skilled OT services. I feel like that's such a mic drop sentence because you're speaking to exactly how these mothers feel. You do feel like you are struggling in silence. You do feel like you're doing something wrong if you speak out to say, I feel really sad. I feel really frustrated, and then you have your partner who's maybe like, come on, like, you're fine. Let's get going, and it's
Yeah.
it's balancing all those balls at once. So my question to you is, so if a mom is feeling this way or she's listening right now and wants to set herself up for success second time around, who should she be having this conversation with to say, we notice a lot of our audience is like second time moms that are coming back who are desiring and actively wanting a different experience and different outcome. who could be the person that they could start having this conversation with to set themselves up with a better, successful home experience?
So I am the only person currently that
Looking at it. This is a brand new concept.
I know.
I mean, it truly is. It truly is. And so I am in the process of starting a business for occupational therapy and consultation services for women. And I'm learning along the way because this is paving a new path that unless there's something out there that I don't know, and I've looked pretty far and wide on the internet. Again, there, yeah. And that's why I'm so honored to be in this space and feel really like we're just entering an exciting time in women's health, because it just takes one or two people to start getting this word out and bringing awareness to something. Because it's not like there's a lack of occupational therapists and home health therapists. We have these skills. It's just mobilizing our profession to see the need, which I think is really cool that on Mother's Day, American Occupational Therapy Association highlighted our article on their front page of their social media and website. And I was shocked. I was like, oh my gosh, I don't know. I wrote this and was like, I hope a couple people read it, But I think that is what it's going to take, of just bringing this awareness and training. And so I have so many ideas for launching my business, which I'm calling Magnolia Women's Wellness. One, to be in the home and doing the treatment or virtually, but also the advocacy part of bringing awareness to it and maybe doing trainings with OTs who already have these skills. Unfortunately, I mean, your OB is who you should be able to go to with these things. But I have, except for my professor's husband, Dr. Skuthan, who is totally on board with this and he just graduated and is going to be starting, as a doctor, but bringing awareness is huge to OBs because that's where it has to start. Totally. Most people don't understand or know what OT is unless you've had a traumatic event or a parent or somebody you've experienced in your life who has had these services. And so it's the education piece and it's those early days. So it's the OB knowing to refer to these services for women who have had C-sections to get that ball rolling. I did bring this to my personal home health company, and it's a systemic issue too, because there's barriers with insurance. There's barriers. Most of the population who's receiving home health that are able to have insurance pay for it are of Medicare age, because Medicare pays very well for these services. And so that is a barrier. I'm not even sure how private insurance works with providing, for somebody under 65, is home health always covered? I have a feeling it's like a prior authorization type of thing.
Do you know, for example, if someone is 60 and they have a hip replacement, is that usually a given for getting home health?
Yeah,
for example?
It is.
Okay.
It is.
So it doesn't necessarily have to be an age thing. And I do think it's something we think about, sort of like if someone doesn't need a nursing home or a skilled rehab facility, like the home health is kind of that bridge, right, to being back to being independent again.
Yeah.
But for some reason, we haven't identified the postpartum women after a C-section as being a group of people that might need these services. I just want to highlight more of what other types of things an occupational therapist might do for a C-section mom. So we talked about setting up the home environment. What are some other roles, other things that in a perfect world, if someone is set up with these home health services and sees an occupational therapist, what do you think? Once a week? Twice a week? What's perfect?
I mean, typically, especially the first evaluation should be within the first 48 hours of returning home. And that is something within home health in general, that as soon as the doctor orders the services, the first visit, start of care, has to be started within that acute time frame of being home. So I think that's super important. And then after that, once you do the full evaluation, it's a personalized, tailored approach to what does that specific mom need. For typical home health services that not necessarily for C-section population, twice a week is very common, but there's also going to be, depending on the case, there's going to be nursing involved who's also coming maybe 2 times a week, and physical therapy who's also coming 1 to 2 times a week. And then we have a social worker on staff, and her whole goal, her job is to tell patients about all the resources in their local area based on their socioeconomic status, what they
That might be another
eligible
one.
for.
Yeah.
Exactly.
Yeah.
Exactly. In this article, obviously our focus was on occupational therapy, but our scope as every practitioner, like you have your scope of practice. And then when you realize a patient or client's need is outside of your scope, that's when you refer. And it's a team effort. Like none of caring for moms, caring for anybody, for wellness, health and wellness is never, in my opinion, just one person who's going to check all the boxes. It's a team approach. And then that team who is talking about the patient and what their specific needs are. Like in my professional job, we have on Wednesdays a team meeting where we discuss our patients as a team. And so that's where in this population, it's bringing in the OB and like all these clinicians discussing with the OB, how's this person progressing? Are their needs being met? Is there somebody else that we need to bring in?
Have you heard the concept of a medical home?
No.
Okay. It's just the idea, I think, of there being maybe one place that can kind of coordinate with all of these different parts of the kind of interdisciplinary team. And I see this home health maybe led by OT kind of being that middle resource that can then branch out and discuss all of these things and the needs, like you said, with the physical therapist, communicating with the OB, et cetera, et cetera. I feel like that's a role that could be, and for short term, right? This is not forever, but I really want to get back to all the things that you can do. I don't want to miss that because I feel like we haven't even like, why is it so important? So setting up the home, tell us the other things, because I think it's just so interesting and kind of varied and just covers so many of the things that we worry about after a C-section. So can you just go through a couple more of those things besides setting up the home that you as an OT could do?
Yes. So body mechanics for your everyday activities. So like you guys talked about of getting out of bed, what is the most looking at, it's not a hospital bed where it can raise and it can lower and the head can go up, and so there's different modifications that can be made, or just different modifications in your body mechanics. You may not even need adapted equipment to be able to more safely get out of bed. And again, this does go into environment, but when you've got your baby next to you in the bassinet, like let's walk through what it looks like to pick up your baby. And occupational therapists work, a huge part of our training is in task analysis. So you're breaking down tasks in the smallest parts to be able to see where is there dysfunction, where do we need to modify, and it's so individualized.
Like, are you breast or bottle feeding? If you're bottle feeding, where are you storing the bottles? How are you cleaning the bottles? Where is your sterilizer or whatever? Probably, right? It's so it could go on and on.
I also think too, like if you had multiples, right? If that was the reason for your C-section, or also too prioritizing if you have young children. Like mine were all close together. So the biggest hurdle for me was my husband didn't have paternity leave. How was I getting them in and out of a crib? How was I getting them in and out of a car seat? And it's like, that encompasses the home environment as well.
That's your occupation mom.
Right.
Yeah.
It's a toddler mom. Yeah.
Absolutely. Because they send you home and say, don't pick up anything heavier than the baby.
Right.
And you're like, well, that's great in
Good
theory.
Good luck with my 2-year-old or 4-year-old or whatever it is.
Exactly. And you've got to get out to doctor's appointments. You have to figure out like what is the best way to lift a car seat. And so those are all things if you have a plan to go beforehand and say, let's practice some of these everyday tasks that you don't have limitations on right now, but just getting your body in, muscle memory of learning how do we ergonomically pick up a car seat? How do we get our stroller in the car? When you're not technically supposed to be picking anything up, but if you have nobody there, like, what do? You have to.
And even if you don't get a 6-week OB visit, you got to go to the pediatrician, right?
Yeah,
so
exactly.
How are you going to do that?
Yeah,
exactly. And so it may not look perfect, but how can we adjust things in those body mechanics to keep you as safe as possible, while also doing your everyday occupations that you have to do? And then, on top of that, what we can do is looking at we're not nurses, but we do have training on looking for signs of infection, with the C-section scar, and having eyes on that. Oftentimes in my practice, I'm the first one to do a shower with a patient or client. And, after you've had a baby, you're used to, like, if you don't have a lot of privacy.
Goes out the window a little bit.
Exactly. But like the shower is a really big safety hazard because oftentimes
She's
you've had
talked
a lot
about
of
that before.
Yeah.
Getting
it's
lightheaded in the
huge.
shower.
No, I always
Yes.
say to every single one of my clients, you do never take that first shower home alone. That is not
Never.
like somebody runs out and that's your personal
No.
time. Like someone should be standing outside that door so that if you
Yes.
need any assistance, you have it right away. And two, like just going back, like thinking like if there was just a bar that was put there temporarily, how that would, if you had that head rush, that you knew you had that safety net to hold on to that bar, because just the wall sometimes is not enough. You need to
No.
stabilize yourself in a different way.
And who thinks through all these things? Like you don't, right?
just
need
don't.
someone
No.
like to go
Because
through
you've
those
never been
things
in a
with you.
place.
Yeah.
Yeah, you've never, most of the time, women of childbearing years have never had to think about any of these type of things.
Yeah.
That you would
I
maybe
never had
think about if
surgery.
you
I
were-
never had anything
Yeah.
medical in my life. So not only had no idea how to take care of a child, had no idea how to change a diaper, breastfeed, nothing. I also was one of the first of my friends. And then I never had surgery, had never been in pain, had never had to take a pain medication in my life. The
Yeah.
amount of firsts that were just like all in those first that week, 2 weeks was just,
Yeah.
I don't know how I did it, honestly.
Yeah.
That's where then mentally it really like it can compound things in such a big way.
Yes.
And that's when like that like
Yes.
slow creeping anxiety can come in, because you're like,
Yes.
I'm not doing what I thought I was going to be able to do. And you feel down about yourself.
Totally.
That's why I think we spend so much time like wanting to give knowledge, and education is giving that foundation for confidence. And we all have to
Yes.
have that confidence to be able to provide for our newborn.
One
and
less
ourselves.
unexpected, one less thing that you're like, okay, I know that having a shower might be challenging. I'm prepared for it. I'm ready. I have a plan. Whatever, even going to the bathroom. We talk a lot about
Yes.
the
Yeah.
first poop
Yeah.
after a
Yes.
C-section.
Squatty potty.
The squatty potty. She loves the
Yes.
squatty potty.
Everybody needs one.
Everybody
Thank
needs
you.
a squatty
Oh
potty.
my gosh. CJ.
Yes. No, I know. I'm also a big fan.
Can I tell you an exercise that I'm going to be doing on my car ride home? I love to call my insurance company and ask them
Yeah.
questions.
She does this.
Okay.
Yeah.
I do. And I'm 100%.
And she's like, no, I'm not pregnant at the end of it. Like she asks all these questions.
Well, because they always end the call with, congratulations, when are you expecting? I'm like, no. I've already had my children. This is research that I'm doing.
Yeah.
But I do think it's a really good exercise that I'm going to take on after we finish our discussion. I'm going to call my insurance company. I'm going to collect some information, and then we can come back with our audience and I can give the response. I always say it matters who you speak to on the other end. If you
Yes,
don't feel
it
like you're
does.
vibing or they're hearing what you're actually really saying, hang up and call back.
Yeah.
Why not?
You call back again and again.
Yeah, until you
Uh-huh.
get that person. But what would you say if I was calling my insurance company? What would you think are like some important key notes that I should
Ooh,
ask?
I like this. Because the homebound, I want you to talk about the homebound status and how
yes.
that relates to home health and how that should relate to C-section moms.
Absolutely. I would ask specifically, what are your benefits for home health in general?
Okay.
Like, despite my age, what are the benefits for home health? And then for the homebound status, that is set by the Centers for Medicare and Medicaid.
Mhm.
And you have to have certain criteria that deems you homebound. And so not being able to drive and not being able to get out of your house is one of the qualifications.
Check.
Not being able to navigate stairs, check.
Mhm.
It's a taxing effort to get out of your house. You need the help of another person to get out of your house.
Yeah.
The list goes on. If you have any like visual impairments, which maybe a mom does, if there's any cognitive deficits or mental health conditions that make it hard to get out of your house, like almost every single criteria, if you go on the website, you can, and you read it right there, and so talking to the insurance companies, if these are the qualifications, they say, women of childbearing age don't have resources for home health, and those are the things to be able to bring up of saying like, well, why,
Yeah,
like,
right.
why can that 60-year-old woman who isn't a Medicare age, but she had a hip replacement, why can she have home health services, and a woman in her 30s, whatever age, having a C-section with the same precautions not qualify? And so I think that and maybe they do offer that, but then it's the connecting the dots of the education to those OB providers and home health companies, because I think that even if home health companies are willing to take, those private insurances that may have to require pre-authorization, more work for them, do their clinicians feel comfortable treating this population? Because a lot of times I think that is a barrier as well, where training needs to come into the picture, and to be able to, show and train clinicians, like there's really not that much difference between purely from the surgical rehabilitation. I do think that co-occupation of infant care may be out of some people's, comfort levels if they've not personally had kids or they don't feel comfortable. But even still, even if you were just giving the mom that post-op care, would be so important.
Totally.
Yeah.
Oh, I can't wait to call my insurance company. They're really going to love me today.
They're so excited.
I'm excited to hear what they say. And going back to what OTs can do, because it's so, the list goes on and on, but you guys mentioned pain medications. We do a lot with medication management. There's such a piece to that has to fit into those occupations of your day. And taking medication at the right time, reading the instructions of what you're supposed to be taking and when. If you're taking any other medications, can those interact, or do you need to take them several hours apart? I mean, there's such a mental load with anybody being sent home from the hospital with a new medication list.
Yeah, especially when they send you home with some combination pill like a Percocet or something that has Tylenol in it. And you're like, okay, I don't need the Percocet now. I need the Tylenol. And then little do you know that you're maybe taking too much Tylenol, which you can overdose on.
Yeah.
That was a huge thing for me. And of course, like being an anesthesiologist, I knew what I was taking and I knew exactly how many hours I could take it and staggering it and this and that, but it was still so time consuming. And thankfully I had my mom, and I'd be like, Mom, I just took an Advil, like write it down. Tell me in 6 hours when I could take the next one or whatever it was, and had this running list. But that's a huge thing. It's
and
snowballs,
later on
right?
Like you're exhausted.
And you're exhausted,
you could forget.
But you
that
also don't
took
want to,
it.
depending, and I had a very bad experience with pain. Not everyone does like I did. But for me, with the pain, it affected my ability to breastfeed. It affected definitely my mental health. It all connects, and it's just such a snowball effect. So to take any of those, simplify any of those occupations, things that we have to manage and handle postpartum is just, life-saving, really. It's just amazing concept.
And it's just nothing new. Like this is what OTs are already doing.
Right.
In the home. It was all these light bulb moments when I started really looking into, simply like having a notebook set up that has the time, taking blood pressure. That's a big thing. Because a lot of after surgery, orthostatic hypertension is what you
can be anemic. You've lost, and your fluids are shifting all over the place because we get all these fluids, then you pee it all out and this and that.
Yes.
And you have to monitor for postpartum preeclampsia.
Yes.
Taking your temperature if you're worried about infection.
Yeah, exactly. And just having a log of all of those and educating women, again, is so great if it could happen before surgery, but even after. Do you have a blood pressure cuff in your home? Do you have a thermometer? How do we set up this, either a whiteboard or a notebook or something that is so easy and simplified to just be able to jot down, my blood pressure today was this, my temperature was this. And then if you start to have any complications, say a couple of days in, you have a whole log you can take to your OB and say, this is what all my numbers were. And then they started rising. So to show, any of the complications.
What doctor wouldn't love that?
Yes. Exactly. I tell all my patients to do this because you have to have data for them to understand the full picture. And when you're like, I think yesterday it was this, you don't know, like you have to have it written down. And then you've also got your baby that you're
you don't even know what day it is.
Exactly.
Like, what day is it actually? So
honestly, everybody should be given a whiteboard at their baby shower.
We love a whiteboard. We love a notebook. You are speaking our language. And little did we know this was actually backed by someone who's actually knows what they're doing. Yeah. This is trial and error for us, I think. But
Not for me.
Yeah.
Give me a little respect, Jen.
No, I listened to you all's episode on the home recovery, and everything you said, I was like, yes, yes, yes. Like, this is from a personal standpoint and professional. Like, yes, you guys are doing amazing work by getting the word out
I'm
there.
so glad she was. So we talked about setting up the home. Okay, the medications, feeding, right, the baby, looking at the incision, and
pain.
Pain. What about
pain management is a big one
Yeah.
as well, that we have a lot of training as OTs of not only the pharmacological interventions, the pain medicine, but non-pharmacological interventions, which is a really big focus in the hospital, home health, for across the board for anybody who's having chronic pain, because there's so much you can do with breath work and with guided meditation and movement and the mental health side of things, because pain gets in that positive feedback loop that if you're thinking about it constantly, you know, it doesn't mean that the pain isn't real, but there's so much as OTs that we can do to focus on that non-pharmacological pain management with incorporate all of those strategies I just mentioned, but also the body mechanics. Okay, every time I do this, I am like in so much pain. Okay, let's look, like, do it exactly how you've been doing it. Show me. And then I can see, you know, that task analysis, breaking things down. Well, if we just modify this one piece of the puzzle that I can tell, like, that is why you're in so much pain, you avoid having to take more pain medicine, you know?
Right.
And so I think that is such a big thing with the pain management that is often not talked about. I think for women, it's like you just handle it or you just push through the pain, and that's not the answer.
Yeah.
Right. We just love what she is doing. This is truly so groundbreaking.
We hope you're walking away with some new insight into how occupational therapy can truly transform your C-section recovery at home.
But trust us, there's even more to this story. Next week, we'll be back with part 2, where Dr. Caroline Rich takes us even deeper into the world of holistic occupational therapy recovery for C-section moms.
See you next week.